everyone, and welcome to another edition of For the Health of It. I'm Lou Beccaria, and it's a pleasure to have you with us once again. Thanks for tuning in. In your travels, you may have encountered the term autism and not really known what it was about. Well, our show today has been developed to kind of give you an understanding about the term autism as a medical condition, and also to avail you of some information about resources that are available now here in the Westchester area that are also available for citizens in Phoenixville. So with us to talk about this new resource is Dr. Phillip Duncan, who is the director of the Southeastern Pennsylvania Autism Resource Center, or SPARC as we refer to it. Dr. Duncan, thanks for being with us. Thanks
My
for
pleasure.
taking time out of your academic schedule.
Great to be here.
Well, let's start off with kind of a broad question, Dr. Duncan. What is autism as a disorder, I guess is the right term for it?
Yes, that's correct. In the literature, in the field, it's really called an autism spectrum disorder, and that spectrum is probably the key term because what that refers to is a variety of behaviors or absence of behaviors taken together defining autism. And so, broadly brushed, one could say that autism is characterized by excesses in some behaviors and deficits in other behaviors. And so that any one child or any one individual, and typically we see children, any one individual would exhibit certain combinations of behavioral excesses and deficits.
I see.
And if they fit on the diagnostic manual's requirements for autism, then we would say that that individual has autism, for lack of a better word. And so one might see excesses, things like tantrums, or a condition called echolalia, where a child might repeatedly repeat a little word or phrase that he or she has heard excessively. Deficits would be characterized by an absence of play with others, an absence of verbal behavior, an absence of social relations, even with parents.
Wow.
And so, although there are a variety of behaviors which are on the spectrum or make up the spectrum, it isn't necessarily the case that any one individual would show the same characteristics as another individual. So in the field, one says if you've met one child with autism, now you've met one child with autism, because everyone is individual and different.
Has research in this field uncovered what may be some of the root causes of this? Is it chemically based? Is it an emotional trauma situation that may have occurred in a young person's life or some other?
Yeah, there's a great deal of debate about what the causes are, and there is no agreement about it. People are actively conducting research, but we simply don't know for certain. Most experts assume and agree that it's probably based in some sort of brain problem, whether it's structural or biochemical, genetic. It simply isn't clear. There's a great deal of work that's being done, as I say, and it's possible to show that certain brain areas fire or don't fire in a way that's not characteristic of typically developing individuals, but so far no one's been able to correlate that brain activity with specific symptoms.
Yeah.
And so whereas somehow it's probably biochemical, exactly how that works is not at all clear.
Yeah, it's too new. It seems like from a layman's standpoint that the term autism is one that we hear more frequently right now, but say 15, 20 years ago, we didn't hear very much about that, and it wasn't as readily diagnosed.
That's right. Frequently we're asked about the increased publicity that autism gets, and of course there are lots of newspaper articles and magazine articles and TV shows about autism, and we get a question, is it happening more than it used to? And again, there's a debate about that, but most feel that probably the rate of autism is similar to what it's always been, probably misdiagnosed in the past, overlooked. People high functioning on the autism spectrum were considered eccentric, but not really disordered. And so more recently, as professionals have been more aware of the disorder, it's probably being properly diagnosed. Those who do diagnosis are probably looking at it more carefully and making a diagnosis and hopefully getting individuals access to treatment quicker than before.
Dr. Duncan, in families that have multiple children, and is it prevalent or not prevalent that more than one child might be afflicted with the disorder of autism?
Yeah, that's a good question. The concordance rate, the probability genetically is higher than you might expect statistically. But again, the probability is not one, not unity, and so other factors seem to be involved. Mm-hmm. Other factors seem to be involved. Yeah.
Now, in the title of your organization, Southeastern Pennsylvania Autism Resource Center, the word resource, does that mean that you also do research as well as treatment of this, or are you strictly a treatment facility?
It means we do some research. We chose that title carefully, resource, because we wanted to serve as a resource to the community, and certainly for autism issues. Certainly the heart of what we do is clinical therapy, and that's certainly the case. But to do that therapy, we provide a comprehensive diagnosis, a comprehensive assessment and evaluation of someone who would come to us. From that comprehensive evaluation, we would develop a treatment plan, and that treatment plan would be implemented by our professional staff at the clinic. We would quickly involve parents or other caregivers at the parents' discretion to learn how to do that treatment plan, to implement it at the clinic, and then as quickly as we can, we move that treatment plan to the, suppose it's a child, the child's home, school, daycare, wherever that child goes. We want those who are caring for that child to be able to implement that treatment plan. So we do treatment. In addition, though, a part of the resource is a research, because as we do therapy, we collect data on the behaviors that are targeted for that child. And so we collect those data, and those data then can serve to help us evaluate how effective we've been, if we think we could try something else a little different than we started with. We collect data to see how that change is effective. And so we can then systematically analyze those data and what we've done, and that becomes the basis for research. And although we haven't done a lot of that as we've gotten started here, our intention is to continue and expand our analyses of the data for our clients as a research tool. Beyond that, though, we also try to serve as a community resource, because we'll do training for other professionals who deal with children on the spectrum. We'll do parent training sessions. We haven't started yet, but our intention is to provide or offer community information sessions where simply anybody from the community could come in, and we would present issues having to do with autism and the autism spectrum. And we've done some of the professional training already, and we collaborate with a number of agencies. So that resource term really does refer to assessment, evaluation, diagnosis, therapy, research, community information sessions, professional training, a variety of things.
Regarding the diagnosis part, at what age would autism typically become prevalent, and what signs would parents, grandparents, and those who associate with a child, look for?
Yeah, good question. There's some research with some people in California who think they can possibly notice some difficulties as early as age 1. Some parents will say they knew something was wrong almost from the beginning. But age 1, age 2, in a kind of classic development, a child will develop typically through 18 months up toward 2 years even. And then what happens very sadly for parents is they notice the child who has been talking, talks less and less, who has been playing appropriately, starts not to play, starts to resist interactions with other people, with other children. And so these kinds of behaviors are frequent.
So it's around 1.5 or 2.
1.5 or 2. Even at 1 year, the folks in California are saying if a child is playing with a toy, for example, or an object, if the parent gets behind him, if they're concerned, these folks have said if the parent can sort of get behind the child and call his or her name, and the child doesn't respond, this could be not an indication necessarily of autism, but an indication that they really ought to follow up a little more with a professional. Because,
red flag.
Because a typically developing child at about age 1 who's playing with a toy, and the parent's behind him, and they say, John, John will turn to the parent.
Well, the term autism, you know, the root of it kind of means self. So I guess autism is where the child becomes so consumed in his or herself that they wouldn't necessarily respond to that stimulus of somebody calling out the name.
Yeah, it is in many cases. It is as though they're sort of occupied with their own interests, and so this object becomes very important, and everything else is sort of irrelevant. Yeah.
Certification. I know that, you know, we've recently just covered a minute ago how kind of new the whole field of autism is. But is there a certification process for centers such as Spark that developed, or is the field not yet that mature to do that?
There aren't, at least to my knowledge right now, they're not certification centers as such. Perhaps the closest thing in Pennsylvania that exists or is about to exist is the state is attempting to set up 3 regional centers for the study of autism, one in the west, one in the center, and one in the east. This is coming out of efforts by Speaker O'Brien and by Ms. Nina Walcote, who essentially coordinates autism services for the state of Pennsylvania, the Bureau of Autism Affairs. They're trying to designate 3 locations in these 3 parts of the state, which would serve as sort of centers designated by the state.
Okay. My guest is Dr. Phillip Duncan from Westchester University's Spark Center, the Southeastern Pennsylvania Autism Resource Center. We'll be back in just a minute after this word from our sponsors. Please stay with us. Hello, everyone, and welcome back to For the Health of It. I'm Lou Beccaria, your host. And for those of you who may be just tuning in, we're talking about the disorder of autism today. And we have the pleasure of talking with Dr. Phillip Duncan, who is the director of the Spark Center at Westchester University, the Southeastern Pennsylvania Autism Resource Center. Dr. Duncan, let's get a little bit more in depth into the center, actually. I mentioned that it's located at Westchester University. How did it come to be located at Westchester University?
Well, that's a long story. I'll try to give you the short version. The university is always seeking to establish better relationships with the community. All universities do that. And so there was an inquiry several years ago now that came to psychology department, as it did to other departments. Essentially, did anyone have any ideas about possibilities? And I suggested we might investigate whether some organization that dealt with autism, perhaps a clinic, might be feasible, because I'd been placing my undergraduate students as student therapists with families in the region for quite a number of years. And I'd noticed what I thought was quite a need. But I hadn't really pursued that because there was no real mandate to do that.
Sure.
So a request came out, and so I thought this might be a good idea. I proposed the idea, got a little bit of seed money to investigate further, hired a former student who had in the meantime obtained her doctorate and had worked with children with autism who had moved back to the area. And so as she developed and I developed community relations and talked to individuals and professionals and parents, it became clear to us that actually a clinic that served children on the spectrum and their families might well be both a good idea and actually practical. We, over a period of about 2 years, convinced the university authorities that this would be a good idea. And so they gave us permission, essentially, to use a little bit of space at the university to start seeing clients. And that practice has simply developed to the point we are now, so that Spark is now has its own 501c3 nonprofit corporate status, independent of the university now.
Which means that if people or organizations were to donate, that it's tax deductible.
It's tax deductible, and they're certainly welcome to do that because the university does not fund us.
Okay.
It doesn't. We pay.
You're
rent
parented, but you have to be self-sufficient.
That's right.
Yeah.
That's exactly right.
What services? I know we briefly went over this in the first half, but again, if you could mention for those who just tuned in, what services does the Spark Center provide at Westchester University?
We provide a comprehensive array of services. In an ideal situation, those would begin with an initial evaluation, assessment, diagnosis, which would occur in the clinic, in the home, in the school, wherever the parent wants. We think it's very important to see the child in the community where they live, to see how they function in those areas. We don't think it's sufficient to simply see a child in the clinic and really have an informed understanding of the nature of their behavior problems.
Right.
So we do assessment, evaluation, diagnosis. We then provide an array of services ranging from home programs where we would help teach the child a variety of behaviors, simple labeling because they typically don't do that. Self-help skills, age appropriate, as for eating, for dressing, for cleaning themselves up, a variety of self-help skills. Later on, social skills, which are very important for children with autism. One of the big deficits that I mentioned earlier was the ability to interact with toys or with other children. We'll have children who literally do not know how to play with a toy. And so we have to teach them that. They do not know how to play with other children. And so we have social skills groups, play groups for a variety of ages of kids to do that.
What are the qualifications, Dr. Duncan, for people who work at the center to do the diagnosis and treatment and so forth? What are the qualifications?
Our clinical director, Dr. Jennifer Dawson, has a Ph.D. in behavioral clinical psychology from, in Jennifer's case, Louisiana State University, which is an American Psychological Association approved training program. So she had all the coursework and all the experience that are necessary to provide these sort of diagnoses. In addition, then, Dr. Dawson happened to work at the Johns Hopkins Kennedy Krieger Institute in Baltimore for a number of years, working with children on the spectrum. So she brings a vast knowledge of children with autism as well as diagnostic experience to bear. And she's the one right now who does our diagnosis evaluation work.
Right. Does the Spark Center serve just people in the Westchester area or all over Chester County or beyond?
Now, when we created the title, we called it the Southeastern Pennsylvania Autism Resource Center, and we really meant that. And we got very interested in even when we wrote our business program, to say we intended to be the kind of the leader in that area. And so we serve certainly the Westchester area, but Chester County and counties beyond that. We have clients from New Jersey, we have clients from Delaware. And so our intention is to really be a resource center for the region and not just Westchester.
Yeah. Does the Spark Center subscribe to a particular therapeutic model for the delivery of its services and diagnoses?
Yes, we do. Our approach is one called applied behavior analysis. And all of us at the center are trained in this field, which essentially says that behavior is the issue with these children. As I mentioned earlier, either excesses or deficits, and those behaviors are affected by events in the child's environment. The difficulty as we see it is that the typical environment, the normal environment from which you and I and everybody learns, even without trying, the environment teaches us stuff, our parents and our interactions. For some reason, with children on the spectrum, that typical environment doesn't teach them the behaviors which are viewed as adaptive by society, by parents, and we don't understand why that's the case. It simply seems to be the case.
Right.
And so our job then is to rearrange environments that will teach these children the variety of skills they need to learn. And so that's what behavior analysis is about. It's the treatment of choice for these children, and as a matter of fact, it's the only approach to therapy for children with autism which has been empirically verified through research.
Right.
There are a lot of other treatments which may work, but none of those other treatments have gone through the research and replication that behavior analysis has gone through. And
right.
so this is the only approach that's been verified.
In order to pursue this model, obviously you need funding to operate the center. And you've alluded to already that although you get free space at the university doesn't pay your bills. So how do you pay your bills? Are you insurance certified and qualified, or foundation grants, individual donations, or
right.
all of the above?
Actually, we pay the university for our space.
It's not donated.
So it's not free.
Donated. Okay.
For a while that worked out as they helped us get started. But
okay.
we now pay rent for the space we have.
I see.
So we are completely self-sufficient.
Self-sufficient.
And so in order to fund ourselves, we have a variety of means. Our clients are private pay. So the client pays a fee, and part of our permission to start by the university was we had to charge market rates for our services. We were not allowed to undercut agencies in the community, so we charge market rates because we were required to. In addition, though, we've certainly seek and have obtained funding from foundations, from individual donors, from corporate sponsors. East High School in Westchester had a lock-in run by their student council that raised money from the students, and then other individuals and corporations gave matching or supplemental funds to that. We don't work directly with, I shouldn't say that. We are not providers, in-house providers for insurance companies, in-program providers. And I don't know that we'll pursue that right now, because that becomes a very complicated thing for a young organization like us.
But it certainly seems like there's a movement. I know Representative Dennis O'Brien, the Speaker of the House in Pennsylvania, has been very active in trying to get autism, the disorder of autism, covered through insurance, at least up to a certain level for families that have to deal with this issue. So there seems to be a movement for third-party payments. Yes,
Speaker O'Brien's been a terrific advocate for autism, and to try to get insurance companies to support families who are in need, and we've supported that effort as well. And so what we'll do with insurance companies or for our clients is to document as much as we can the services we've provided for our clients, and we'll advocate to their insurers for them so that they can get reimbursed for the services we provide.
Right. What is the contact information, Doctor, if someone wants to find out more about your center?
Sure. The phone is 610-430-5678. That will go to the Spark office. Our email is sparc@wcupa.edu. And our website, which is being revised right now, one could simply look at www.wcupa.edu/SPARC, and that would bring up our website.
All right, we'll flash that on the screen too, so people will be able to see it as well as hear it. What are the future goals, Dr. Duncan, for the Spark Center?
Well, we have a number of goals we hope to achieve. Right now, we are cramped in our physical space on the university campus, and so we're looking to expand our physical facility. We're looking at a site now which would allow us to do that. As we're able to do that, we're also, and one of our goals is to expand our staff a little bit, because constraints of space create constraints of staff, and constraints of staff create constraints on how many clients we can serve.
Right.
And so as we move to larger space, we hope to expand our staff and therefore also expand our client services. So that's a goal. Another goal is one where we would like to be able to help persons who have more limited financial means. Because we're a startup and because we're pretty much living hand to mouth right now, we're restricted in our ability to support those who have limited financial means. And so what we're hoping to do is develop a scholarship fund, essentially a pot of money, which we could draw on to supplement client fees where they couldn't pay the full fee.
So you want to tear down economic barriers, and so that this service is available to everyone no matter what their economic status.
Absolutely, because it's very, very hard to see a child who clearly has a need, the family clearly has a need, but they don't have the means to pay the full cost.
Just briefly, we only have about 45 seconds left, but does the Spark Center collaborate with any other organizations in the community in the carrying out of your mission?
We've talked with every community organization we can find about autism, from the Devereaux Foundation, Melmark, Elwyn, the Chester County Intermediate Unit, private providers, anyone who's Easter Seal Society, Cerebral Palsy Society, anybody who sees kids on the spectrum, we will talk with them. We've tried to talk with them. We're interested in talking with them. We see ourselves as collaborators in a very big problem. We don't have the means to deal with the scope of the problem, and so collaboration is the only way to go. Okay,
before we sign off, once more, some of the contact information so we can give you a little bit more publicity on this.
Sure.
Phone number?
610-430-5678. Email sparc@wcupa.edu, and our website wcupa.edu/sparc.
Good. Okay. We're out of time. I wish we had more time to talk about this. It's been very interesting and informative, and thank you for taking time to come see us.
My pleasure.
It's always a pleasure to talk with you, Doctor.
Thank you.
And thank you for taking time out of your day to be with us. It's been our pleasure to bring you this informative show on autism and the resource here in our community, the Southeastern Pennsylvania Autism Resource Center based at West Chester University. I'm Lou Beccaria, and remember, if you're healthy, you're wealthy. I look forward to seeing you around town. I look forward to inviting you into our studio to see the next show. Take care. Have a nice day.